Good morning, and thanks for waking up with us. This morning I'm sitting down with lead urologist Dr. O Baloo to talk about men's health. He will share some great advice on how prevention and wellness are key components to living a longer and healthier life. Well, good morning. Thank you so much for being with us this morning, Dr. O Baloo.
Thank you.
Share a little bit about yourself and your experience.
Okay. I'm originally from West Africa. I came to the U.S. at age 17 to go to college in pursuit of a long life ambition to be a physician. I ultimately went to medical school in Philadelphia, did my surgical training there, and then we moved. I practiced in Eastern Kentucky for about 10 years before coming to Sydney, Ohio. I'm married with 3 adult children.
What do you view as the biggest issue with men and their overall health?
I believe the biggest problem is that men don't seek medical attention early. They don't actually go to doctors. I have a lot of patients who will tell me, I've never been to a doctor unless something is affecting them. And the problem with that is multifold. Number one, if they were to have a diagnosis, it's oftentimes caught later, which reduces survivability. Women, on the other hand, every woman has a best girlfriend that she shares everything with. Sometimes to men's chagrin, but but it works out well. And so if there's anything, if a lady notices anything wrong with her, she'll share with that friend, and oftentimes that friend will encourage them, will say, I'll be your anchor. I'll go with you to your appointments. They'll help them research and find ways to combat that issue. Men, on the other hand, only will go when something is wrong. And I use football analogy in saying that it's like playing prevent defense instead of playing to win.
Yes. Well, I hope my husband is watching. So, Dr. O Baloo, what do you feel is the most prevalent men's health issue in your opinion?
I believe prostate cancer is, and of course I'm biased being a urologist, but it's true because prostate cancer is the second leading cause of death in men in the United States next to lung cancer. And it's a disease that's preventable. When I was in medical school, finishing up, 4% of men diagnosed with prostate cancer survived. That meant 96% did not. And that was just 25 years ago. And within that time period, with the advent of PSA testing and prostate cancer screening, we've made a tremendous improvement. And now, for locally diagnosed prostate cancer, ones that have not gone anywhere else, the survival rate is about 98%. That's fantastic. And even for those that are metastatic or that have advanced, the 5-year survival rate is about 30%. But I still believe that we need to continue in this front, not to lose ground to the progress we've made, And for PSA, really the gentleman who discovered it has made a great impact on mankind. Roswell Park Laboratories and a urologist called Dr. William Catalona, they were pivotal in getting PSA approved, and it's been commercially available since 1994.
You mentioned the PSA test. At what age should men start having their PSA test?
Okay. Yeah, that's changed through the years. Initially it was age 50, but also those who have a higher propensity for prostate cancer, such as men with a family history, African American men, because the variant of prostate cancer in African American men is a little more aggressive. So it's recommended for family history and for those men that are more predisposed at age 45. PSA or prostate cancer screening should continue from age 50 to age 75.
Okay, great information. Signs and symptoms.
Okay, there are really no known signs and symptoms for prostate cancer because a lot of the signs and symptoms are really similar to prostate enlargement called benign prostatic hyperplasia. So some guys may notice frequency, if they're going to the bathroom more frequently, if they're having hesitation in going, if they're going a lot at night, okay, any of those symptoms need to be evaluated nonetheless, and only a urologist will be able to differentiate if it's a benign prostatic enlargement versus prostate cancer.
Okay. Any other key men's health issues that you want to bring to the forefront for our viewers, for any men watching today's episode?
Yes. Another issue, being a urologist that I see a lot, is erectile dysfunction. And as a urologist, I believe in men's health. And part of men's health involves their sexual health. The percentage of erectile dysfunction in men between 40 to 70 is upwards of 40%. And a lot of times, because it's embarrassing, and with our social mores and cultural values, no one wants to talk about it, but it's the elephant in the room. And there are ways we can address it, correct it, and get guys back in tip-top shape.
That's great. Yeah. Good information, and I'm happy that we addressed it today. What action should men take to lead a healthier life? Okay,
the basic format for every man or woman is a balanced diet. That's reducing processed foods, regular exercise, reducing cholesterol, controlling high blood pressure, diabetes, heart disease. Erectile dysfunction, which I mentioned earlier, has actually been tied to heart disease. A lot of times when a guy presents with erectile dysfunction, it may just be the initial symptom that they have heart disease. There's something called endothelial dysfunction. The endothelium is the lining of the blood vessels, the heart, and the lymphatics. And endothelial dysfunction means that the blood vessel doesn't distend or dilate like it should to allow blood flow to the end organs. And the artery of the penis is the first place that endothelial dysfunction happens. So when a guy has erectile dysfunction, they need to go see their urologist, and oftentimes we can trace it back to heart disease.
So to wrap up, Dr. Ogbolu, what is the first step men should take if they would like to seek urologic care?
Yeah, they should call a urologist. I'm seeing patients. And some practices recommend getting a referral. Okay. I don't, so they can either be referred or call directly to my office.
Thank you so much for being with us this morning. Our goal with these episodes is to share some really relevant information, and the people watching can take action, and I think we accomplished that today, so thank you so much.
It's my pleasure. Thanks.
Tune in next month where we'll sit down with our pediatric team to talk about kids' health.